This is a very important and timely topic, COVID-19 and vaccines. Nearly 350,000 Marylanders have been infected with the coronavirus, confirmed, and likely more than that. This state has seen over 6,800 deaths from the coronavirus. And now that we are very fortunate to have 2 vaccines on the market and being distributed, there are many people who are very interested in getting becoming vaccinated. So we are very happy this evening I'm very happy to be here with my colleagues, Delegate John Carden, Delegate Dina Stein, Delegate Lisa Bell Castro, our panelists, Dr. Chen and Dr. Branch. And I'm going to turn it over now to my colleague, Delegate Stein, but just wanted to say this is a very timely, important issue. We are hearing from people about their frustrations, about their concerns, about getting access to vaccinations. And we hear you and we share your frustrations. And we have 2 wonderful healthcare professionals with us here tonight who can hopefully answer a lot of the questions that we have heard and that you have on your minds. So Delegate Stein, thank you. Delegate Stein, you're muted.
Thanks to everyone who signed up for tonight's town hall, and thanks to our guest speakers for joining us to answer questions. We've received dozens of questions on eligibility for the vaccine, registration, timeline, and other topics. They reflect the huge interest in the vaccine. And as Senator Hedelman said, we know there's a lot of frustration with the process. We won't be able to get to all questions tonight, but we will do our best to respond to any unanswered questions in writing. So now I'd like to introduce my colleague, Delegate John Carden.
Thank you, Delegate Stein. Thank you, Senator Hedelman and Delegate Belcastro. My job tonight is to welcome our guests and to tell you what the agenda is. First, we're going to hear from Dr. Gregory Branch. He's the health officer for Baltimore County. He will have some very important information for us from the county perspective and what we can expect the county to be doing and all the pertinent information up to date as of today. Then we're going to be hearing from Dr. Wilbur Chen, Chief of Adult Clinical Studies and Medicine, Center for Vaccine Development and Global Health at the University of Maryland. And we are just thrilled to hear from him, the professional understanding and more technical side of vaccines and from a national perspective and from a policy perspective on what's happening. So I look forward to hearing from everybody. And now I am supposed to pass it off to Delegate Belcastro.
Thank you, Delegate Carden. Hello, everyone. Thank you for joining us tonight. I'm Delegate Lisa Belcastro, and I have the honor of introducing currently the busiest person in Baltimore County, Dr. Gregory Branch. He serves as Director of Health and Human Services for Baltimore County and is tasked with coordinating the COVID-19 testing and vaccine rollout. Dr. Branch, we know you're busy. Thank you for being with us tonight.
Good evening, everybody. And first, I would like to acknowledge the District 11 representatives, Senator Hedelman and Delegate Stein, Carden, and Belcastro. Thank you for providing this forum. Thank you for getting this information out to all your constituents, and thank you for including me in this discussion. I appreciate it. So I extend a virtual handshake and a simulated fist bump to everybody who's listening. So I'll only take a few minutes because I understand that there are several questions you have, and I want to leave time for that. But I would be remiss if I did not take this opportunity to remember the Baltimore County residents that we have lost to this unrelenting disease. As of this morning, Baltimore County reported that 1,098 members of our family, our friends, and our neighbors have died secondary to COVID. But I want you to know, Baltimore County Department of Health, we are working tirelessly to slow the spread, to vaccinate our residents, and ultimately save lives. So what's the role of the health department in this pandemic? In order to do what we do, Health and Human Services has simultaneously run 5 massive logistic operations: Hotline, contact tracing, outbreak investigation, testing, and mass vaccinations. These major products and projects require significant staffing and infrastructure, and we are accomplishing each of them with military precision. Now, on the vaccine in general, Baltimore County leads the state in the number of residents vaccinated. We have vaccinated over 21,000 individuals since receiving our first 100 doses on December 23rd. And we anticipate distributing 8,000 vaccines at clinics that are happening just this week. Nationwide, the vaccine is limited, and that holds true for the state of Maryland and Baltimore County. Unfortunately, we don't know how much vaccine the state will allocate to us week to week. So I cannot predict when we're going to get everyone vaccinated. This problem is not unique to Baltimore County. For the foreseeable future, demand is going to be higher than the supply. Therefore, until we have ample supply of the vaccine, we will not be able to vaccinate everyone, let alone trying to move into phase 1C. Currently, we are continuing to serve individuals in phases 1A, and that's our healthcare providers, our first responders, et cetera. And then those who are in 1B with a specific emphasis on our seniors who are 75 years and older. Right now, our vaccination clinic is housed at the Timonium Fairgrounds. We are in the process of bringing vaccination clinics into communities and looking to open up additional sites on the east side and on the west side of Baltimore County. But in the meantime, please help me to encourage everyone to get on the registry. This will allow us to have the information we need to contact individuals when we have vaccine available and we are serving their specific category. So let me be clear. Getting on the registry does not create an automatic appointment to get a vaccine. But getting on the registry does provide us with the information we need to determine your category. And then getting on the registry provides your contact information so that when we are serving your category and when ample vaccine is available, we can invite you to schedule an appointment. Now, getting on the registry is quick and easy. You go to www.baltimorecountymd.gov/vaccine registry. Everyone should register. Everyone should register, especially those in the communities that's hardest hit by the pandemic. So our African Americans and Latinx communities have been disproportionately impacted by the virus, and members of these two communities continue to be hospitalized in large numbers. And far too often, they succumb to the disease. So I repeat, if you live or work in Baltimore County, please visit our vaccine registry and enter your number. Getting on our registry will help accomplish my top priority, which is scaling up our vaccination program so we can get the needles into arms as soon as we receive the vaccination in our hands. Why is that? Because vaccines don't save lives, vaccinations do. Getting vaccinated would ultimately make the difference in our final push against this extremely contagious and potentially deadly virus. So again, thank you for allowing me this opportunity. And I want to just close with a reminder. Remember the 3 W's. Wear your masks, watch your distance, and wash your hands. Please complete the vaccine registry form today. Thank you and God bless you.
Thank you so much, Dr. Branch. Very helpful information. A number of people submitted questions when they registered for our town hall tonight, and some additional questions have been put in the chat in the Q&A form here. So I just wanted to direct some of the questions that I think are on a lot of people's minds. A lot of people have signed up on the registry and have done so even weeks ago and haven't heard anything. When can they expect to hear something? I know that some jurisdictions do automatically send an email saying, we got you, we got your form, and you'll wait to hear from us when we have enough product.
So that's basically what it is. As soon as we get enough vaccine, you will hear from us. When we first started the registry, there was just a confirmation screen that came up. At this particular time, we've changed and updated our registry. So when you register now, you'll receive an email that will say you have now been registered. So you got to remember, we just kind of started this as quickly as we possibly can. So we hear what people are telling us, and then we try to make our changes as necessary.
Thank you. There are, as we showed on an earlier slide, and I think everybody knows, a number of different priority levels. And I think there are some questions and concerns about why some of the lower priority levels have been opened up when the higher priorities, the people in those categories, haven't all been vaccinated yet. And especially, I know there's a lot of concern among older adults and those with compromised immunity and other health issues, and concern about why they're not being prioritized even within those different priority categories.
I will say to you that the priorities that's been set forth and the opening of all the different priorities is something that is done by the governor's office and the state Maryland Department of Health. I, as the health officer for Baltimore County, has no control over that. But I will say to you at this particular time, because there's limited vaccine, and I'm gonna give you some numbers so you can get a sense of what I'm talking about. On the registry right now, I got over 20,000 folks who are over the age of 75. I get about 5,000 to 7,000 vaccines per week. So you can see it's going to take me a while to be able to get through that and to that. And I'm still working on, believe it or not, folks in 1A, which is our health professionals. I'm still working on that group also at this particular time. So when you see people come through the line, sometimes you'll say, well, why does that person look so young? Well, that person is probably a healthcare provider who needs to get vaccinated.
We've seen some of the data, and it is available on the Maryland Department of Health's website about where we are with regard to vaccines that have been provided to the state. And some of those, there's way more that have been distributed than have actually been used. Can you talk a little bit about where those choke points are and how come generally things aren't happening quicker, even with the doses that we already have in the state?
So what I can talk about is Baltimore County. Because I'm not too sure exactly where all the other vaccine has gone. The state distributed that, and I don't know what's happening with that. In Baltimore County, we got our first 100 doses on December 23rd. I can tell you that on the evening of December 23rd, all 102 doses were in someone's arm. So as we get a vaccine in Baltimore County, we're putting it into people's arms. What you have to remember and understand is what the data is showing you. So we receive vaccine on Tuesdays. And what happens is, if you look at the amount of vaccine that we've given out on Wednesday, it reflects what I just got on Tuesday. So it seems as if I didn't give out a goodly amount of my vaccine. So if I had 5,000 vaccines and you gave me 2,500 more vaccines, if you do the math with that, it looks as if I haven't given out my vaccines. However, If you look at that same number on Sunday or Monday, you will see, and you look at the data, that we've given out 100% of our vaccine. So when you give me the vaccine on Tuesday, whatever you give me, it's usually going to take me that week to give it out. So it's not an automatic thing that you give me vaccine on Tuesday and I give all the vaccine out on Tuesday or Wednesday. It's usually going to be given out throughout that week into the weekend.
When do you find out how many vaccines you're going to get on that Tuesday? Like, how much planning can you do at this point in time? What are you being told by the state or the federal government?
I don't know until the Saturday or Sunday before the Tuesday that I receive it.
So how is it that people can make appointments and be assured that there is enough vaccine for them at their appointment?
Because what I do is I don't put the appointments out until I actually have the vaccine. And I don't do that, obviously, because you've heard around the country that people had vaccines clinics set up and no vaccine. So I put those appointments out as soon as it gets into my hand. That's what goes out immediately, the appointments. So if I get on Tuesday, let's just say 5,000 vaccines, then you'll know that I'll have those vaccine clinics set up throughout that week immediately.
Okay. Do other entities such as hospitals in Baltimore County get their own rations of vaccines? And can you talk about the other, I know there are other entities that are providing vaccines such as CVS and Walgreens to senior living communities. Are they in any coordinated fashion under your umbrella of your office?
Not under my office, not at all. All of that is done either through the federal government or the state government. That is not under local jurisdiction.
Neither hospitals nor senior living communities.
None of that's under me.
Okay, so it seems to me that this is a very decentralized process. And if you're giving advice to somebody who is in one of those categories that's already eligible to receive a vaccine, what do you advise them to do? There seems to be a state website. So many hospitals have portals that you can use now. Do you say you should sign up everywhere? I know you want people to go to the registry, but if they've gone to the registry and they haven't heard anything, what should they do?
They can sign up everywhere. Period. I'm not going to stop anybody from not signing up. Go and sign up everywhere, because I have no control over when I'm going to get vaccine and how it's going to come. So I don't know that. So let's just say there's a hospital that's signing you up, and I don't know if they are or not. My point of fact, then I would sign up. If you work in another jurisdiction, I would sign up in that jurisdiction also. You know, I would sign up in as many places as I can possibly sign up for, so that you can get the vaccine as soon as possible.
Okay. We have some teachers who've posted some questions and some concern that private school teachers have been vaccinated before public school teachers, and some trouble that public school teachers are able to receive their vaccinations. Can you speak to that?
For the public school teachers, or teachers in general, are in the one, is it B? I think 1B category at this particular time. And so I can tell you that private school has not gotten any more than public school. So that is not the case at all in Baltimore County. And so that we do, and we are trying to give some of our teachers a vaccine, because obviously many of the, we're trying to get the children back into school. However, as the health officer for Baltimore County, my priority at this particular time is those who are 75 and over.
Okay. And how do people know that you're verifying whether people are in fact in those categories? How do you do that?
Well, basically what happens, in fact, is you have to come with your identification. So that when we had our healthcare workers, you had to come with a letter or letterhead or a prescription from the doctor's office in which you've worked, stating that you are a healthcare provider, a healthcare worker, or you had to have a copy of your license with you.
Okay. And do you have any sense or gotten any indication? I know President Biden the other day said he was hopeful that in the next couple of weeks, the states will receive more doses. Have you gotten any additional information about what to expect in the near term and longer term?
I've got nothing, but I'm with President Biden. I'm hoping and praying that we can get more at the local level, but I don't know at this point now. He probably knows better than I do.
I would hope so. No offense, but I would hope so. I think we could probably go on for many, many hours asking you questions, but I want to continue on, and then we'll circle back if we have more time, because I know we have so many questions that people submitted. So why don't we continue on?
Okay.
Okay, well, thank you again, Dr. Branch, for joining us with the county updates. You can find Dr. Branch's contact information on the screen. So now I'd like to welcome Dr. Wilbur Chen, who will discuss the efficacy of the vaccines. Dr. Chen is an adult infectious disease physician and scientist and professor of medicine at the University of Maryland School of Medicine and chief of the Adult Clinical Studies section within the Center for Vaccine Development and Global Health. His research career has been focused on developing vaccines against global infections, including influenza viruses. So he is eminently qualified to provide us information on the COVID-19 vaccines. So Dr. Chen, thank you so much for joining us tonight.
Yep, thank you so much for having me, Senator Hedelman and delegates Cardin, Belcastro, and Stein. And so I think that you want to hear mostly about efficacy, but I'll just start off with saying that Dr. Branch does not run a fiefdom. And what you're hearing is, I think that he has his limited powers and jurisdiction. And it's very confusing because I think that there are a lot of local jurisdictions that are independently deploying vaccines. So part of the confusion is we don't know how much vaccine is coming at the state level, at the county level, and other local jurisdictions. But also, to coordinate all of that with all of these different entities. And so I think his advice was sage advice to try to sign up for different organizations and different places because it's really just, it's problematic that it's not a centralized, unified system, but that's what we have to work with. And I think that you've also heard that Dr. Branch is trying to fly the plane while building the plane. And so, he's having to make on-the-fly decisions and changes. So I applaud kind of his accomplished work that he's done already, and he's still not done, and he continues to work in the background. So I think that I just wanted to be very supportive of our local health officials because all of them have been working tirelessly, as you heard. So let me talk about efficacy of vaccines. And the way that I'll talk about it is that, these vaccines, let's acknowledge that they were all developed in very fast timelines. I want to assure the audience that that does not mean that we skipped over safety procedures and that we were able to accomplish the studies that were needed by the Food and Drug Administration to be able to review these vaccines and approve them for the emergency use authorization based on a full set of safety and efficacy data. And the efficacy for the two vaccines that we're using, the Pfizer and Moderna, are essentially similar to each other. So I really don't think that one is very different from the other. And they're basically 95% efficacy, which is incredible. I just cannot tell you how great that is. And that's efficacy against symptomatic illness. If you look at the efficacy against severe disease, which is hospitalization and death, so we had tens of thousands of people that were involved in the efficacy studies. There was one severe COVID case among vaccinees in those two studies collectively. So that gives you an idea of how much efficacy we have with these vaccines, which means that I don't want to undersell these vaccines. I want to really say how powerful they are as a public health tool to save people's lives and to hopefully eventually get all of society out of this situation so that we can open up all business sectors and parts of the government and everything else. So open up society again. And I think that the only way that we can do this is by being able to immunize high proportions of the population, which is what some people call herd immunity. I don't like to use that term because we're not cattle. I like to use the term population-wide immunity. And that really is where we are looking at 70% or higher percents of the population being successfully immunized. But in between that time and now, we have to just be patient, because these vaccines, as you see and hear, are being deployed as fast as we can, but it's difficult to deploy to all of the populations that have been prioritized. I'll also say, I sit on the CDC's ACIP committee, which is, the policy-making committee for the national, for the CDC. And a lot of what we talk about for the prioritization is really thinking about an ethical framework that builds in health equity into the distribution of these vaccines, because we've seen the burden of disease among communities of color and other populations that have really been hit the hardest. And so we want to build in the distribution of these vaccines as part of our framework for health equity. So, that's just kind of to tell you how we think about prioritization and how we think about the policy making at the national level for the deploying of these vaccines. I'll stop there, and because I recognize that there are going to be a lot of questions, and I'd like to answer those individually.
Okay, well, thank you very much, Dr. Chen. I do have a few questions for you. And one relates to the fact that the vaccine was developed and brought to market so quickly, which was amazing. It's a real testament to research and science that it's been able to, these vaccines have been developed so quickly. But one concern that some individuals have is that maybe we don't know the long-term side effects of the vaccine because the vaccines have been brought to market so fast. Can you address that concern?
Yeah, with the many licensed vaccines that have been on the market for many, many years, I would like to know what are the long-term side effects that are actually significant enough that a person would not get vaccinated again with those vaccines. So there really are not any scientifically plausible or biologically plausible long-term side effects that I can think of with these mRNA-based vaccines. I think, again, with our licensed vaccines as a way for us to, understand what are the potential long-term side effects, we really have an absence of long-term side effects that are very serious and severe. And especially in the face of a pandemic, would these long-term side effects, which might be minor side effects that are long-term, would they be enough that it would offset the balance of the value of the vaccine, of the benefit of the vaccine? So again, what you're trying to do is weigh the benefit against the harm. And a person is trying to say, well, what is the long-term side effect? Is that harm going to outweigh the good of the vaccine? And I would say there is no evidence for that.
Okay, good to know. And another question about the vaccines relates to the fact that this virus is mutating quickly. It seems that there have been new variants of it that have been developed and that spread more quickly than perhaps the original version. So do we know how effective the two vaccines that are currently being used are against these variations of the virus?
Yeah, so we still don't have the definitive efficacy data for what these variant viruses do exactly. But let me give you an illustration to demonstrate. So with the three different variants that have been talked about in the public press right now, it's the UK variant, the South African variant, and the Brazilian variant. There's one variation in the receptor binding domain, so kind of one major change in that critical part of the virus in the UK. And then in the South Africa and the Brazil, there are three different changes, okay? So each of these changes kind of are cumulative, and the more changes there are, that's the more potential that it might kind of have the ability to change the efficacy of a vaccine. Well, let's think of a vaccine's effect as like facial recognition. So you can recognize my face. If I change one little thing on my face, like I put a fake mustache on my face, are you not going to be able to recognize me all of a sudden? No. It's just that I might be able to trick you maybe 100% of the time if the room is dark and whatever else. Okay, well now I put on a mustache, I put on some glasses, and I put on a little beauty mark or something, 3 different things. Now it gets a little bit harder, but you can still recognize me. Okay, so if you get my drift, this is kind of the analogy that I'm trying to use, is that these variants, the more that you add on, the more that it can look different. It's not like the vaccine all of a sudden just doesn't work at all, 0 efficacy. It's just that it declines from that 95 maybe down to 93. And then with 3 of them, now it's down to 90. So cumulatively, it will decline. So again, that's why it's important for us to have active surveillance for these viruses. These variants can also affect not just the vaccine's efficacy, but also our diagnostics, so that our diagnostics don't pick up these viruses as well. With the same, what we call sensitivity and specificity. And also maybe our therapies may not work as well either if they're very specific for the virus. So these are all potentially there, but we haven't seen that yet. What we've seen so far is evidence that they transmit better. We've seen very early evidence that there is just a microscopic increase in the severity of disease that it might confer. And that's on the order of, if the original virus causes 1 death per 1,000 people that are severely affected, then these variant viruses, it looks like it's 1.3 deaths out of 1,000. Okay, so that's the change. So again, this is not like a wide scale change where all of a sudden nothing works. It's basically, we have to watch them very carefully, because as we see more of these variants and accumulation of mutations, that we see a decline overall in efficacy. So I hope that I explained that, because I really don't want people to be so alarmed. It is something that we scientists are watching very closely, these variants, because of a lot of the consequences that I just talked about. But I don't want people to also be just so alarmed and paralyzed by the fear that this creates. It still means that we have to depend on the same old measures of masking, hand washing, physical distance that Dr. Branch said, the 3 W's. And as long as we continue to observe that, that will protect us against those variant viruses as well.
Okay, great. And to follow up about the 3 W's, should individuals who are able to get vaccinated, should they continue with those protective measures even after they've gotten the vaccine?
Yes. So that 95% efficacy means that there's a 1 in 20 chance that you may not get that complete protection, which is, again, I think that it will protect you against severe disease, but it may not prevent you against having symptomatic infection, which is enough to transmit, by the way. So, and on top of that, we don't know if it prevents asymptomatic infection, which means, again, you could be asymptomatically infected and still infect grandma and grandpa, whoever you're visiting, your friends and relatives. So again, you don't want to be that person, even despite that you were vaccinated. So that data is not clear yet. So I think we still have to maintain that aggressive posture of the 3 W's until a high proportion of the population has been successfully vaccinated. And we see then our numbers in the state of Maryland just plummet. When we see cases really drop down, then we know that we can really open up society again.
Okay, and my last question, Dr. Chen, is just a follow-up about your point about the future that we all look forward to when society can be opened up again. When do you think we'll get to that population immunity? I realize there's a lot of guesswork that goes into that, but I think you use 70% of the population being vaccinated as sort of the benchmark when maybe life won't return to the way it was in 2019, but there'll be some semblance or normalcy again.
Right. And that normalcy will be at least having K through 12 schools opened up again, preschools, colleges and universities, and then all business sectors, being able to go to the beauty salon and going to the movies and going to the restaurant, indoor dining, those sorts of things. I'd love to have all that. So here's my prediction. I think, again, you heard from Dr. Branch that he's trying to work through phases 1A and B right now. We are in the state, opened up to phase 1C, but of course you heard that limited supplies of vaccines limits the ability to actually effectively go through the 1C, even though it's technically open. But I think that as we get in through this winter and into spring, we will have probably been able to vaccinate most of phase 1's A, B, and C, such that by the end of spring, we will be embarking on phase 2. And I'm hoping that by the time we are at the end of summer and beginning of fall, that we'll have primarily gone through most of phase 2. And at that point, if, again, the summertime is when we see a dip in respiratory viruses already, just like we saw last summer, that we saw a dip in the early summer, that in addition to our being able to vaccinate a lot of phase 2 will drive the virus transmission down so that we will be able to open up and stay opened up. Now, the problem with the last summer is that a lot of that summer transmission was driven by young adults. The data shows that it was mostly teenagers and young adults. A lot of it was probably transmissions that started out like in Ocean City and other vacation spots where a lot of young people were congregating over the summer and ignoring a lot of the physical distancing, and masking. And basically, that's where the ongoing transmissions were. So the data were very clear that all of that summertime transmission was because of failures in us maintaining the 3 Ws over the summer. So if we can maintain that over the summertime, in addition to the vaccinations, we actually could get over this by the fall.
Okay, great. Thank you very much, Dr. Chen.
Thank you very much. I think I'm just going to formally thank you, Dr. Chen, for the very valuable information. And I'm going to mention, because of some you and Dr. Branch had already said, there will be a town hall that is available. The recording of it's available on Facebook that the Associated Federation, along with LifeBridge Health, did regarding some of the perspectives and issues from their physicians as well as from the hospital system and how they are approaching vaccination. So if people are interested from the private side, that may be something that they'd be interested in looking at. I have a number of questions that have been given to us in advance that maybe we can just continue the conversation on, but I was going to let Delegate Belcastro start because she's been, it looks like, chomping at the bit, wanting to ask some questions.
Thank you very much, Delegate Cardin. We do have a couple of questions. We have a lot of questions, actually. I've been trying to sort through them as they've come in. The first one is going to be, if you're in tier 2 for a high-risk disease, will you need a letter from a doctor in order to get the vaccine? That one might be for you, Dr. Branch.
At this particular time, that probably will not be the case. We're going to have to work our way through that and how we're going to do that as we get through the 75 and over and the 65 and over. And we're going to see how much vaccine we're going to need at that particular time. We will see exactly what happens. Unfortunately, so many of our people have a lot of these chronic diseases. And so, trying to make a person go to the doctor to get a letter is maybe more of an issue than it's really worth.
Okay. And Dr. Branch, you are just so generous with your time. You're going to be in the hot seat for a little bit. A lot of these questions are geared towards you. People are clearly anxious about wanting to get the vaccine in Baltimore County. This next one's a really good one. And I'm happy to have the opportunity to ask it. It says, my mom is 96. She's homebound at my house. I received an email to bring her to the fairgrounds in Baltimore County, but that trip is not possible for her. How can we get someone to come to our house to vaccinate her? I guess overall, is there anything that the county is doing to help those that might not be able to leave their homes?
Yes, that is the case. We're working through this as we are, as we speak. The issue that we have is the vaccine is not a single dose vaccine, right? And so once you take it out of the vial, you've got to use it within a certain amount of time, and you got to keep it at a certain temperature. So the issue is trying to get to one person's house with one dose. It's not impossible, because I got a few tricks up my sleeve. So we're definitely working on this, and I will have a plan for this. At this particular time, and this may sound horrible, and I don't want it to sound horrible, but I have so little vaccine that me trying to do that pieces at this week is not going to be good. Once they start giving me more vaccine, we are actually planning on a system to be able to do homebound folks. So yes, that is going to be the case. And we've just updated our registry that when you register, that's a question on our registry. So like I said, as people are talking to us about certain things, we're kind of fixing this. And just like Dr. Chen said, we are building this plane while we are flying. I have the delegates on the line at this point now, and I'm just going to say something because I think it's clearly evident. Over the past 20 years, the resources to the health departments have gone down. And I will say that you go to the restaurants, you go to the swimming pools, you go to the hospitals, you go to the nursing homes, you go to the fruit stands, you go everywhere, and you have no problem eating that food or engaging in that entertainment because public health has already been there and we've checked it out for you. And despite that, our resources go down, the money that we get goes down. So I don't have the infrastructure to be able to be ready for a pandemic. So I'm building this plane as we're flying because our budgets have been cut. And I'm not talking about on the local health department, the local side. We've been getting a lot of support from the local side, but from the state and from the federal government, it gets cut. And so what I ask at this point now is continue to fight, because this is the stuff that's very, very important. Everybody's asking about a computer system, and this doesn't work, and that doesn't work, and we're building it right now. Remember this, because we went through H1N1, we went through Zika, we went through Ebola, and everybody continues to forget that what's going on with the health departments. Can we please invest in the health departments so that we can have the resources that we need so that when this happens, we are ready?
Yeah, Dr. Branch, you're doing a great job building the plane as you're flying it. And I think that you being here tonight and answering these questions really shows that to people. You're working really, really hard. And we do appreciate all that you are doing during this difficult time. Couple more questions from me. Are appointments for the second dose of vaccines guaranteed, and how do residents go about making those appointments?
They are guaranteed, and when you come in, and you'll see that my folks are doing this with military precision, and I don't know if any of them are on the line at this point now, but I gotta say to the Department of Health in Baltimore County, they are fabulous. And I'm gonna say this to you that I don't think anybody else can say to you, any other health officer can say to you, but at the fairgrounds, we can do easily 750 people per hour, and I can probably go to 1,000 people per hour. I don't have the vaccine. But I'm gonna move on from that and say that when you come to the clinic, you have to wait 15 minutes. After you get your shot, you have to wait 15 minutes. In the time that you're waiting, I have you do 3 things. Fill out a evaluation. I have you make your appointment for your next shot. And we also have you register for the state vaccine program, which they then text you every day to ask you, did you have any complications? So that's when you make your second dose. And yes, it is automatic for you to get.
Awesome. That's great. Thank you, Dr. Branch. Dr. Chen, this is going to be for you. This question says, I'm 76 years old and take medications for diabetes and high blood pressure. Will the vaccine interfere with my meds? And what do I, or should I be concerned about side effects?
So it should not interfere with your medications at all. These are mRNA-based vaccines, and the mRNA does not integrate to your DNA. Some people ask about that. Doesn't change your genes in any way. It degrades down. It doesn't interact with medications. As far as the side effects, I think, to honestly say that it has no side effects is wrong. So it does have some side effects that I would expect, that you might have some injection site pain, some achiness, feverishness. Some people feel like they have a mild flu or something like that. And for some people, it's rarer, but some people do feel even more symptoms. All of these symptoms are, will go away on itself by about the third day is the latest. You can take some Tylenol, ibuprofen, naproxen, whatever you like, and that usually does minimize those symptoms. Some people do feel like it's bad enough, they feel flu-like enough that they want to call out sick. And so people should, their employers should understand that this vaccine is important enough that we want to have good uptake, and people should be able to take off of 1 or 2 days of work, understanding how important this is. So I just plead with people to be patient with people who are getting vaccinated, because there are some reactions, but they are temporary. There is the question about anaphylaxis, and that is a rare event. The CDC has just assembled their looks at both the Pfizer and the Moderna vaccines, and it looks like it's on the order of 2.5 to 5 cases of anaphylaxis per million doses. So it's exceedingly rare, and that is why we have that observation period of 15 minutes, because anaphylaxis occurs within usually the first 10 minutes post-vaccination. It's what we call an immediate reaction. And it is a reaction where if we observe it, we can treat it. And as long as we manage it appropriately, it's no problem. But those are the people that will not be able to get second dose of vaccine, the people who have this anaphylaxis. So that's the only contraindication to vaccination. So this person who questioned, 76 years old, not a problem. Diabetic medications, not a problem. I would encourage this person to get vaccinated when that vaccine is available to that person.
This is Dr. Branch. Let me just add to what Dr. Chen just said. From a practical perspective, when you come into the Baltimore County vaccine clinics, there is a physician or provider there. So if you have any specific questions about yourself, we have providers there, medical experts, who can actually talk to you about you. I know that some people get a little concerned because they're on a blood thinner, right? So we can talk to you about that. That is not a contraindication for not taking it, but if you let us know that, we can give you the injection a certain way. And if you have allergic reactions and things like that, we may have you wait around for more than 15 minutes because you have a history of having some type of allergies. So just talk to the doctors when you get to the vaccine clinic.
Great. This one could be for either of you, if you both want to take a stab at it. What medical issues are considered to be high risk?
So, there's a CDC website that is a great clearinghouse for all this information, because a lot of times during this pandemic, a lot of different types of information change. So I always want to encourage people to go to a single source that is a great source for information that should be trusted 100%. And that's the CDC's website. But, I'll just list off a few of them, and I might not remember all of them, but certainly diabetes, obesity, prior heart attacks or strokes, cancers, or any immunocompromising condition, which includes people who have had transplants, people on anti-rheumatologic agents, those sorts of things, they are at high risk.
Great, thank you. I'm just going through all the questions that I have. We have a lot of questions. A lot of them are repetitive, or a lot of them have been answered throughout the webinar. John, our Delegate Cardin, I'm not sure if you've seen any questions that that haven't already been asked, if that you wanted to add.
There's two questions. First one that I have. First one will be mostly for Dr. Branch, which is is there going to be an attempt at any time? I know with your resources stretched thin, and you did a very eloquent job of making sure that we understood that we need to keep fighting for you. But is there going to be any attempt over the next few months to try and coordinate with the private providers so that we can have one place to go, we as in residents of the 11th district can have one place to go to find out the information that best gets us, as opposed to trying to sign up on 5 or 6 different sites to try and get a vaccine?
So hopefully something like that is going to occur. Right now, it's very, it's not the most coordinated at the state level. So it's very difficult for us to know exactly what's going on. So hopefully, and if I'm not mistaken, the state is working on getting a lot more providers to be able to give the vaccine. And once all that comes out, the state's website is supposed to have what is going on from a global perspective. So that's what we're waiting on at this particular time.
And
so we don't know all the people that they're working with, but we do know that they're working with many.
And they will have your information as well, so that it can
right.
be coordinated. Good. And then I think this is mostly for Dr. Chen. Is there a recommendation in terms of mask wearing? What types of masks? There's been a number of articles about double masking these days. Do you have any advice, recommendations on that second or third W that Dr. Branch was talking about?
Yeah. So I think, and I think that when that came out, that might have been a little bit confusing. So, there are different mask grades in terms of the hospital quality, the medical quality. So the surgical mask is a pretty tight fiber kind of density, right? Has a good filtering capability. And then of course there's the N95, which is really high, filtering capability, really high density of fibers. Now, when you compare that to any cloth mask, there are some cloth masks that are, honestly, they're more comfortable, but they're probably because they're lower density fibers. So, when you're wearing a cloth mask around, and if you know that you're going to go to, say, the supermarket, and you're going to be interacting out in the public, close to people, relatively close, with these variant viruses, we know that they're more transmissible. So I think the idea is understanding that if you're wearing a cloth mask, especially if it has a low fiber density, that you might want to double up on them. You don't have to buy a fancy set of surgical masks or medical grade. Just double up on the cloth mask. But the idea is, again, just trying to get better filtering capability, which basically will block the virus from transmitting. And it's not protecting, when you're wearing the mask, it's not necessarily as much protecting you as protecting the people around you. So really what you're trying to do is have everyone else wear the mask as well, so that we're not putting the virus out there in the air. So cumulatively, again, as a population. So that's kind of my recommendation. So I think, again, think about what cloth mask you're wearing. I don't think there's a police out there. There's no police force that's actually looking at masking and saying, oh, you're wearing one, you better wear two, or I'm going to write you a ticket. But we just want to be mindful that this is the underlying scientific, basis for saying, consider wearing two if you're going to go out there, because we just want to recognize that these viruses are very, very transmissible.
Thank you. So we have a number, as Lisa was saying, we have another number of other questions. Many of them are related to the ones we've already asked. I think that getting us, trying to help create a central location for information, Dr. Branch, and making sure that as that plane keeps going up, that you finish that tail wing, so that you don't, make sure you don't crash. But if you can keep on building that plane and keep getting our guys the information they need, it really is, it's going to hopefully become a smooth transition over the.
But I will say to you that Baltimore County has an excellent website that has a lot of information. So please continue to check that site and the state site, because we update those on a regular basis.
I'd actually like to ask Dr. Branch another question that came in. There are many people who have disabilities who have a very difficult time going online or they might not be able to have somebody else go online and to register for them. How can they, and I've heard this from older people as well who aren't as facile with the social media or computer technology. Is there any way that people can access the registry or reach out to you via the phone or some other way? What do you recommend for people with disabilities?
So the first thing I recommend is family and friends. The second thing I recommend is 311. The third thing I recommend is they can call the health department, which is the COVID hotline, 410-887-3816, 410-887-3816. And we will probably, once they call the hotline, try to get them referred to the Department of Aging, which could actually walk them through the process. So family, friends, 311, health department hotline, 410-887-3816. And then we also try to get them to the Department of Aging. The Department of Aging is starting to work with us so that they can actually handle some of these phone calls too.
Okay, thank you. One more question for Dr. Chen. I know that there are a number of people who have either severe shellfish allergies or severe peanut allergies. And I wonder if you can speak to that and if there are any contraindications with either one of the vaccines with those kinds of allergies.
Yeah, and actually Dr. Branch just mentioned this very briefly as well. But so those shellfish or any food type allergy is not a contraindication, but it is a condition where if they've had allergies to anything before, which is, again, commonly the food allergies are a very common thing. We are asking that those people self-identify because we are going to watch them for 30 minutes instead of just the 15 minutes. 15 minutes is standard for everybody. But once they've declared to us and made it clear that they've had a food allergy, bee sting allergy, or something else, then they will be watched for 30 minutes just out of extraordinary precaution, because where we see the anaphylaxis is actually predominantly among people who have had allergies to other things as well. So even though it's rare, that 5 out of a million cases, we're still seeing it out of predominantly people who've had allergies to other things. So that's why we're watching those people for 30 minutes.
And Senator, I'll just share, if I may, a personal thing. I'm a person with a very, very severe shellfish allergy. I'm very, very allergic to those where I would need epinephrine if I ate that. And I will tell you that I took the shot and did not have a problem at all. So I'll just share that with everybody who's listening to let them know that, yes, tell us, we want to watch you a little closely, but you should still take the shot.
Okay, very good. There was something that someone posted that they had registered a second time thinking maybe that their first registration did not go through, and they were, I think, called the office and were told that because they registered a second time that they were canceled. Is that the case, or do you know, Dr. Branch?
I have that makes no sense to me. I don't know.
Okay.
Yeah, that shouldn't be by any means.
Okay. And someone else just said that they went on and registered and did not get an email back. Is that something that's coming and isn't up yet?
No, that should be up. That should be there. So I will check with the IT department regarding that. That should be there.
Okay. That's very helpful. Thank you.
Dr. Branch, I've got a question. There are some individuals that don't have access to a vehicle or don't have, friends or family that can take them to the vaccine clinic. Are there any transportation options that are available for them?
Well, at this particular time, we are still working on the idea that there are going to be some people who are homebound or who would not be able to transfer to a clinic. But we're working on a lot of neighborhood types of clinics, places people go. So many people will potentially be able to just walk to someplace right in their neighborhood. So we're working on all these things. We are flying the plane as they're building it, you know how that goes. But as time goes on, you'll see that we'll have more services out there.
Thank you.
From there, if no one has any other questions, I just want to say a massive thank you to Dr. Chen and just for sharing all of your knowledge with us tonight, really getting some of these questions answered. And Dr. Branch, I want to pause and just give you the biggest thank you that there is. And I hope that you're hearing thank you from people multiple times a day, because your job is very difficult. What you are being tasked with limited resources is very difficult. And it's apparent that you are working really hard, and everyone that's working with you is working really hard. So thank you for what you do. Thank you to everyone that's joined us tonight. We know our offices have been getting a lot of questions from the community. And so we do hope that this has answered some of those questions. If you have any more questions, or if your question was not answered tonight, please reach out to us. We're going to work to get those questions answered for you. You can email our offices, call our offices. We're all there right now because we're in session, and we're always at our email. Next, I just want to thank our staff. Our staff are Maura, Molly, Tyler, Andrew, Margie, everyone in our offices that work so hard to get these questions answered, and also for putting this on tonight for us. With that, I'm going to pitch it over to Delegate Cardin if you have any closing remarks.
I just wanted to thank you, Delegate Belcastro. Just a fist bump to our guests and to all those folks listening in. Thank you, and please be in touch if you have any more questions. And I'll pass it on to Delegate Stein.
Thanks, Delegate Cardin. I'll add to the thanks to our presenters. Very informative, and we appreciate the dedication that the county and the medical community has brought to the fight against the virus. You all have clearly been indispensable. Dr. Branch, a quick last question. If someone does have a registration or process question that hasn't been answered tonight, is it okay if they directly email you?
They can call the hotline.
Call the hotline. Okay. All right. Well, again, many thanks. We know it's been frustrating to many that there have been delays in being able to access the vaccine. Thankfully, President Biden has announced plans to purchase 200 million more doses and send them to the states beginning next week. So hopefully they'll just start being filtered down to Baltimore County relatively soon. And as you've heard, Baltimore County will open additional clinic locations so that they can absorb and dispense these additional doses. But as Delegate Belcastro said, until you get your vaccine, if you have particular questions about the process, call the county hotline or contact us directly, and we'll do our best to help. Now I'd like to turn things over to Senator Hedelman.
Thank you very much. And again, my thanks. I just want to add, like Delegate Belcastro said, our staffs, especially during session, work really, really hard. And you talk to many of you in the community who have so many questions. So I just want to thank them so much for putting this on, and thank the public for joining us and bearing with us during our snafus. But I'm glad, and I know I've gotten lots of texts and postings here. So really appreciate people's patience and for being with us. Someone just asked if we could post the hotline number again is 410-887-3816. That's the county hotline. I will say I was out at the fairgrounds the other day. It is a well-run, well-oiled machine there. People could not have been more welcoming and warm. It was very well staffed. There were a ton of people who tape on the ground. Could not have been clearer. So I just want to thank you, Dr. Branch and Dr. Chen. I know you both are working 24/7 these days. We really appreciate all of your hard work and appreciate your willingness to be here tonight and to share your wealth of knowledge and with the community. So we really appreciate it. We hear from constituents about their frustrations. We share their frustrations. We wish we had more answers to their questions. And most importantly, we wish we had more vaccines to give you guys to get more people vaccinated. So hopefully that will be coming in the very, very near future. I just want to say again, thank you to everybody. Thank you to the community who joined us. If you stick around for a few minutes on this screen, you will see contact information for all of us. You can reach out, our phone numbers, our emails, and just thank you very much, everyone, for being here. Stay safe and healthy.
Senator Hellman, this is Dr. Branch. She's off.
No, we're here.
Are you here? I just checked with my IT person, and they said that they should get the confirmatory email. So if the person is still on, if it's one of your constituents, please get them in contact with me, because I need to figure out what happened with theirs.